Hello and welcome to Pisgah Health Today. My name is Angela Owen and it is my privilege to host this program brought to you by the Pisgah Health Foundation. The Pisgah Health Foundation is a public 501c3 charity founded in 2019 by a board of 7 caring individuals who are committed to improving the health, wellness, and lives of Western North Carolina residents. We have 2 very special guests today. We have Erin Drew, who is the Executive Director of the Family Place, and Denise Gonzalez, who is now the Program Director of the Family Place. Welcome to our program today, ladies.
Thank you, Angela, for having us.
Thank you.
Erin has a background in social work and nonprofits. She was a home-based family support worker in Georgia for 4 years, after which she became an intern for a nonprofit organization. The organization had various locations within the United States as well as internationally. She worked there for almost 12 years in various countries and cultures before becoming a stay-at-home mom, the most important job in the world, right, Erin? She has 2 children who keep her quite active, and they are also participants at the Family Place for several years. And coming on staff here at the Family Place has allowed her to become more involved in our wonderful and beautiful community. Erin loves sports, travel. We're all ready to travel again, reading and working to make a difference in people's lives. We're thrilled to have you today, Erin.
Thank you.
Denise holds a bachelor's degree in psychology from Florida Atlantic University and has postgraduate education in nonprofit management. She has worked with at-risk youth, trained therapeutic foster parents, and managed specialized treatment facilities for victims of severe abuse and human trafficking. Denise joined the Family Place this year, and we are excited for all of the knowledge and experience that she brings to this team. Welcome to the program today, Denise.
Thank you.
Well, why don't you ladies start by telling us a little bit about the organization, the Family Place, and what you do for families in Western North Carolina.
So the Family Place started in 1997 by a group of community partners and parents who were interested in coming together because they realized that they needed support in parenting. It's a really big job, very important job, and there are a lot of ups and downs with that job. And so they realized that they needed to connect with other parents, they needed to share resources, and they needed opportunities for their children to be able to connect with one another, socialize, develop their skills, and get ready essentially for kindergarten.
Connection is such a huge theme of what you're describing, and how important to think about new ways that has to happen in this year of 2020, which has surprised all of us. Ladies, tell me a little bit about the grants that you have received from Pisgah Health Foundation, and what is something that you're doing with those grants that is helping me make a difference?
So we received 2 grants from Pisgah Health and Foundation, and very excited about both of them. One is for our collaborative program called Connect, and that program is a 7-agency partnership, and with the Department of Social Services, the Health Department, the Children's Center, which is the Child Advocacy Center, Boys and Girls Club, the Transylvania County School System, Brevard Academy, and then the Family Place. And originally Connect was set up to receive all the reports made to the Department of Social Services regarding child abuse and neglect that were screened out. Because generally, if a report has made, there are concerns regarding that child, that family, and it may not have reached the level yet where the Department of Social Services needs to step in, but there are still crisis situations that the family needs help with. So Connect was born, and we have an outreach worker that follows up for the referrals that were made and goes out to those families and works with them on helping to stabilize the situation and get connected to community resources, and in order to help the parents be able to deal with the crisis in a calm manner, get the resources that they need in order to stabilize the home and help the children thrive in that environment. And then our second grant is to help us extend our hours down at our Rosman location, and also to help us to hire additional child care workers for all of our programs, because they have been growing and we've added programs, and we need the support and the assistance working with these beautiful children.
Fantastic. Denise, since you've come into the family place and you're now serving as the program director, what is something that has been particularly exciting for you to see happening through the family place?
I would say the Connect program is pretty incredible. All of our programs are amazing in how we help families, but the Connect program is really hands-on and walks families through all of their needs. So helps them really figure out what are the next steps to take to be able to build resiliency and move forward and prevent any sort of abuse.
Resiliency is a huge word for 2020, right? So like we all are needing to have some additional resiliency. So how wonderful that Connect is providing that. Erin, I understand that the numbers of students, or the numbers of children, I should say, that have been touched through the family place is actually quite significant. Tell us a little bit about that. How many people are you actually serving in Transylvania County?
So in Transylvania County, we have approximately 1,500 children between the ages of 0 and 5. And the family place last year served over 900 of those children. And having that touch in those lives, that's over 600 adults, 600 families. And so we've given over 8,000 units of service to these families in our various programs. And we have a wide variety of programs. We have parenting classes. We have 8 Circle of Parent groups. We have 2 Circle of Security groups running. We have, like I said, the Incredible Years parenting classes that we've just started back, and those were funded through the Pisgah Health Foundation. And, you know, during this time of COVID, it has added a great deal of stress to families. Families are asking us, they were calling us, asking us, you know, when our programs were going to open back up in person. We were able to continue virtually with a lot of programs in the spring and the first part of the summer, and we've gradually done a slow, careful reopen. And we are having parents even call us from outlying counties asking us, can they come to our programs, which is absolutely yes. And but just needing that connection again. And I had one parent call this week and just said, my daughter's, you know, 14 months old, can we come? She has got to know what other people look like other than our family. We've got to get her some socialization. So.
Wow, how important and how incredible to have such an impact, and to have people who are recognizing that and reaching out for more. Ladies, what else would you like to make sure that the viewers know and understand about what either the family place is doing, or something that we in the community can be doing to provide support for you and these families?
You know, the family place, like I said, has a wide variety of programs. We also collaborate with a lot of partners in our community. We have another collaboration with El Centro with community play groups. So we have mobile groups that go out as well. And we're part of the Get Set initiative. And so we work with Sesame Street and Community, and we have those resources available as well. And so we're, you know, I feel like our staff is very, very committed, dedicated to the families in our community. I feel like we try and really listen to the needs of the families and provide resources for them. And families are, like I said, they're under a great deal of pressure right now. I know planning is hard. And so, you know, with a lot of our programs, they're drop-in. So trying to adapt, and we're here for the families.
And I would echo a lot of that. We have such a wide variety of programs. We have programming for anybody. We have programming if you just need to pop in. We have structured programming. We have programming for families who need a little more support. or families who just need a place to go. So we have something for everybody. And like Erin said, we have programs within Brevard, Rosman. We go off site to different camps and different community centers to do our programming. So there's something for everybody.
What an incredible impact you ladies and the Family Place are making on the lives of Western North Carolina residents, particularly those families and the young students. The board of directors at Pisgah Health Foundation, as the rest of us, are also incredibly grateful for the work and the services that you're providing and the challenges that you're rising to meet as you're working through reopening these things in a safe manner, but recognizing that families need that connection, that social interaction, that opportunity to grow and thrive together. So thank you so very much for all that you and the Family Place are doing for our communities at large.
Well, thank you. And just a special thanks to Pisgah Health Foundation as well, so for their support.
Thank you both for being a part of the program today. We also want to thank Wildflower Media for their technical and creative support, along with the staff and the board of directors of Pisgah Health Foundation for the incredible work they do on behalf of our community, and the Physicians Roundtable, who is sponsored by the Pisgah Health Foundation as well. Thank you all for watching today. Until we see you again on the next Pisgah Health Today, stay well.